Hello, this is Aura Soto. I'm recording this video for my class, the surgical procedures. Okay, I have my little hat on, my uniform, and my nice boots on. And I have my table set up with all my instruments too. Right there, you can see all of them. And that's my information, Aura Soto. And I'm gonna start with first, there we go. Yay, we got it. Okay. My first instrument that I have in here is the, okay, Aura, where are you? Sorry. See, I had them in order. First instrument is the Schnitt tonsil clamp. Okay, this one is curved. I'm trying to see so you can see the. Okay, it has serration on it, no T. Okay, and then when you pass this instrument to the the surgeon, you're gonna pass it this way. That way, he can grab it from here and then just start doing what he has to do. So this way here. And this is a clamp that is soft. You use this on soft tissue, and this also reduces the bleeding on the patient. Okay, that's that. The second one, we have the Rochester pin. Okay, the Rochester is a straight one. Okay, same thing. Pass it on to the provider. It's gonna, or the surgeon. I'm sorry. It's gonna be this way on clamp. Okay, so the Rochester is a clamping. This one is used to clamp larger tissues or the blood vessels. Okay, same thing. It has the little serration in here. No T though. Okay. This third one is a tissue forceps with T. Okay. So this one, we can see that it does have the same thing. We'll pass it this way. This one like that, and it does have those little teeth right there. We can see it. There we go. Okay. Tissues forceps with T is for grasping and holding tissues. Okay, and then we have the Lorna. Where are you, Lorna? Don't disappear on me right now. There we go. My Lorna right here. This is the Lorna non-penetrating tower clamp. It's this way, like that. Curve. It has small little T at the end. It's kind of hard to see. Okay, now this one is used for securing a towel, the drapes, tubing, or any equipment. Okay. Next, we have the dressing forceps. A dressing forceps. This one is to dress the wound and to hold the gauze. Straight out. Don't say have anything but the little serrations in here. I don't know if you can see it. There we go. Yep. Okay. The next one is the blockhouse. Okay. This one you pass it again this way. That way the surgeon grabs it from here and then start doing what he or she has to do. Okay, this one, it has a little curve. Okay, there we go. Okay, this one is a clamp for grasping, securing towel, drapes, and holding any, holding anything. Okay, there we go. we go out to the cryo. Okay, the cryo, same thing, pass it out this way, that way he has it, and then just use it right away. He doesn't have to be like, how do I do this? So this way. It has serrations all the way out to the end. And then the cryo forceps is to clamp blood vessels, to grab tissues or the vessels. Okay. There we go. Trying to keep them in order. We also have the Kelly forceps. The Kelly forceps is similar to the cryo. I noticed it. So I was trying to find a difference, and the difference is that the cryo, these serrations right here, they go all the way down to the end. And so that's the only difference. But besides that, and this one is a little skinnier than the other one, so smaller. Okay, so the Kelly is used to clamp the blood vessels, hold heavy tissues. Kelly. Okay, again, passing it this way. Surgeon will grab it from here and then start doing the clamping, or the assistant start doing the clamping. So there we go. Okay. Next we have the Webster needle holder. It's a small one, very small. And this is just like it says, a needle holder. Just a needle holder, and it's used to hold or suture, for suturing too. Okay, like anything small. There we go. That's that. Ouch. Okay. And the following that I have in here is, this is knife or scalpel handle number 7. Okay, number 7, and a number 7 you'll be able to use blade number 12. Okay, blade number 12 and number 7. Okay, I have also number 7. Okay, this is not number 7, this is number 3. Number 3 here. So our number 3, the number 3 handle, and on this one you will be able to use it with blade number 10. Okay, that's that. In here I have the Bokeman rake. This is the large one. Okay, they come in different sizes. I have the large one, and then I also have the small one. This is the small one. Okay, so these ones are used for this instrument serves to use for retractions of a large amount of tissue, and it's a traumatic to the tissue, meaning that I can rip the tissue. Okay, I have in here the Richardson retractor. I have 2 sets here. The Richardson. It has a different angle right here, and then right here. The Richardson's comes in different size too. So we have this size, we have the large one, go on both ends. Then we have the middle one and the small one. Oops, sorry. Okay. The Richardsons are for retracting an organ, tissue, or a muscle. Since muscles are a little hard, so you use this. Okay. The next one we have the Herzing. The Herzing. Okay, the Herzing retractor. go. So this is commonly used for difficult placement of a larger trocar for laparoscopy procedures. Okay, there we go. Kind of looks like an S in here, so S retractor. Okay. Then we have the Myerding retractor. This is a big one. It has like little T's at the end. See if I can see it. There we go. Right here. Very sharp. Okay. So this is a retractor that you use for small, delicate hand procedures or where small, precise retractions is required. Okay. I have the Sense Mueller retractor. It's a tiny one. It has two different heads or two different hands. I'm sorry. This one looks like a little hand scratching. Okay. And this is the scent retractor. Okay. Here I have two, so I can't take it out. Army Navy. The two Army Navy. Okay, I know they're, oh, there we go. Two Army Navy. They're the same size. The Army Navy is used for retracting t-shirts from barrier pads. Okay, and this one belongs in the, sorry, I should have said all of them, right? They're retracting and exposing the area. This big one right here is the Diver retractor, wide in here, and then this part right here is smaller, thinner too. Okay, and this one belongs in the retracting exposing area, and this is an instrument for just a handheld retractor. Okay. This one is the gauntlet retractor. Two different size, smaller. This is a little bigger and kind of goes more inside. This is the gauntlet. This is another one, handheld retractor. Okay. I have here a ring Forester. Okay. In the lower, this one is to hold sponges. Okay, you can use this for a lot of things, for holding sponges, for pulling ant now, or sometimes they use it, I've seen it for like removing like an IUD with this, the Forester. Here we have the double tooth neck. Actually, it's not this. This is not the double tooth. Coming back to that one. I have the Edson tissue forceps here. Okay, there we go. It has T. It has one, and then it goes right inside of the other one too. It's hard to see, but it's right there. Yep. This is this tissue forcet is used on medium or heavy tissue to grab. Okay. Here we have the backup forceps. It's a little different one. Looks like a little hand, but it's not. It doesn't have like T or anything like that, but it is curved. Okay, curved. And this one belongs in the grasping and holding area. Okay, this can hold delicate areas like the fallopian tube or the bowel. Okay. As per Professor Grant, it says that the fallopian tube, you can hold it and it goes right in the middle, so it won't harm or damage the tissue. Okay, that's that. I have here the Messenbone scissor. It's curved. This one is curved. Messenbone scissor. Okay, this is for any cutting or dissecting delicate tissue. It's a small one. So this will be used to dissect or cutting any delicate tissues. And this belongs in the cutting and dissecting area. Next I have here, this is a true one, the Carmela clamp. Carmela clamp. This belongs in the clamping and occluling. Okay, same thing for grabbing and holding the tissue. Okay. One more, I have here the mixture right angle. Okay, the mixture right angle. See it? Again, when you turn, you give this out to the surgeon, give it this way, that way he puts the fingers here and it's ready to be used. Okay, the standard, we have a short and we have a long one of this one. Okay, and these are used to go into tight spaces or around the vessels. Kind of nice. Around the vessels, into tight spaces. Okay. Okay, now we have here the curved Mayo scissor. We have a long and we also have a short one. This is the short one that I have here. Smaller, thinner compared to the other one. Is a thicker one and heavy too. This one's very light. Okay, so this belongs in the cutting and dissecting area. And again, when you pass it to the surgeon, you're gonna pass it this way. He grabs it and start using it. Okay, this is are used for tough and heavy tissue to cut. Okay, and then we have the next one is the straight Mayo scissor. See, it's bigger. And why? Bigger, why heavy too. And this one is cutting suture or dressing. So cutting any dressing or cutting any suture. This one belongs in the cutting and dissecting. Okay. I also have here the Mayo Heger needle holder. It has those little T on it right there. They're not T, they're just like little serrations right here. Okay. So the Mayo needle holders are just used to hold when you're doing suturing. Okay. Put this back on here. I have here the Addison tissue forceps. Yeah, it's a tissue forceps. Okay, it has like little serration on it. Okay, and it's for plastic surgery procedure, used for wound closure, grasping, and delicate skin edges. Okay, this can hold, grasp without puncturing or crushing the area or the area that you're trying to hold. Okay. And here the operating station. Let me see. And I think those are all my instruments for today. Thank you.